moment, I've been spending some time staring out of a window, sort of looking at what is happening outside. So I thought we might use this session just to reflect on what we're seeing out there in terms of leadership. What's happening right now, what's further out on the horizon, and what might be coming in on the tide. So, what do we know? Well, command and control often gets a bad press, but actually sometimes it's absolutely the right thing to do. It's the right mode of leadership. If we've got a critical situation, to use Keith Grint's words, if we've got an emergency, it is fine to command and control. It's fine to have gold command. It's fine for everybody to know exactly what they're doing and not to dissent. Similarly, sometimes you just need to manage stuff well. If you want to build a massive field hospital in the Excel Centre, then Colonel Ashley Boreham on the right here is your man. He has spent years doing that and he knows what to do. It's all known things. So some things are critical and require just command and control, and some things are, in Keith Grint's words, tame and just require good management. It doesn't mean to say they're not difficult or complicated, but they are known things. We know how to do these things. Where things are complex is where you need a different approach. This is where we start to need things like adaptive or systems leadership. So where things are complex, what I mean by that is that they are not predictable in the same way that critical or tame issues are. So you don't know if you're going to do something, that something else is definitely going to happen. There isn't that cause and effect. So if you're in a situation that's new, well, hello. If you're in a situation that's suboptimal, if you're in social care and you're using swimming goggles and a bin bag for PPE, this is your world. If issues are unclear, if there are political elements, if they're multilateral, so you need to work with lots and lots of different people, these are complex issues and they need a different form of leadership. And in the words of Dave Snowden, who's got a wonderful framework called the Cynefin framework, which is worth looking up. What you do in these situations is not to rely on a project plan. What you do is you experiment and you see what happens, you see what works, you amplify what works, and you shut down what doesn't. And we're having a wonderful example in real time at the moment of systems leadership, of people trying out new ways of working and amplifying them. And the idea of putting COVID patients on their fronts was not something that had a randomized control trial in the usual way. It didn't have a project document. Some people started doing this. They started observing what worked in a number of cases, and that spread. They amplified it to the extent that the Daily Mail is now saying, oh, why doesn't everybody have this? But this is systems leadership working out in real time. And in these complex situations, the job is not to jump to solutions. The job is to stand back a bit, if you can. Give yourself a bit of space to look at what is happening and, crucially, to ask questions. Because if you jump to answers, they're probably going to be the wrong ones. So ask questions. So, for example, what model are you using for pandemics at the moment? I see it's flu. Why are you assuming it's flu? What would happen if it wasn't flu? You can get some very different answers if you ask those questions. There's a man called Ben Murphy who has done a video cast for us. He's ex-commander of the Red Arrow, so he's a man who knows all about pressure and difficult situations. And he said this is about not flicking switches to solve the problems. Take the time to assimilate the information, take the time to ask questions. It's not about being the expert here. Your job is not to be the expert. Your job is to ask the questions of the experts. And it's not about being the leader. This is about leadership. It's about distributed leadership. That is, everybody does something. Everybody can behave in a particular way. And whether or not you're on Twitter, go and look at the recent Twitter feed of a man called Greg Fell, who's the Director of Public Health in Sheffield. He's done the most wonderful thread just showing how the NHS has worked together with local government, with public health and environmental health, with the police, with social care, with the voluntary and community sector. This has been an absolutely group effort. And it means listening to other people by definition, whatever their band is, whatever their sector is, and really hearing what they're saying. So picking up this sense of, God, I'm just knackered now. I can't go on at this level. What are we going to do to prepare for that as part of our leadership role? You will get resistance, you will get pushback, but often it's not because of the changes or the pace, but sometimes it's because of the loss that people have had to bear. And if we stand back and think about it a bit, actually, everything that people saw as normal has just gone. The tiniest facet of people's lives. You know, I can rely on my children going to school. I am going to have the same sandwich as I have been having for the past 6 months. You know, everything has gone. So we shouldn't underestimate the profundity of that loss, and giving people time and space, whether it's through one-to-ones, whether it's through chat rooms, whatever it is, to process that loss. And I think there are kind of two key lessons. In systems leadership, we talk a lot about clear narratives and sense making as part of systems leadership, adaptive leadership behaviours. And some of you might have heard me talk about public narrative as well. The key thing here is to have a clear narrative, by which I mean not a slogan, but something that helps make sense of things for people, that answers this kind of why question, why we should do this, that you get in public narrative. If we don't answer the why questions, and if we don't have these very, very clear narratives, then what people will tend to do is to revert to what they know or what they think they can control. And that, coupled with people's optimism bias and confirmation bias, will lead them to start behaving in potentially self-sabotaging or wider, more unproductive ways. So this is an observation, okay? This is not data, don't at me. I live in Islington in central London. 2 or 3 weeks ago, going to the shops, 70 to 80% of people, I would reckon, were in masks, were wearing, you know, ordinary not masks, not proper surgical masks, but just masks. Last week I went, I would say about 30% of people, if that, because people are not getting a clear message with the whys, and they're not therefore able to make sense of it, and therefore they're taking things into our own hands. So part of our leadership role is to keep those really, really clear communication and the whys. But I want to end on a hopeful note. Beth was talking about kind of going into the recovery phase. One of the most striking things from this, to my mind, has been on the way we have reframed things and turned on a dime. You know, things that we would have said took 18 months before, changed in 3 days. And this has been noticed, you know, all around the world. So this is an article from the United States of a view from the UK. And they said, and I will quote this, the speed at which plans in the NHS in the UK are being made, updated and actions upon is extraordinary. So we can actually change. People can change their minds, people can change their actions and their behaviours and what happens as a result. And I think the key thing for me now, if we do start to come into some sort of what are called refinements of the restrictions, is that we hold on to this, so that we do start going outside, we do start getting out into the landscape, we do start reclaiming that kind of old world, but we take that new learning along with it. Thank you very much.